today's installment of Home Solutions. We're coming to you here from the Mix 1041 studios. Dennis Purvis here with you, as always, from Pro 93 Home Solutions. And as always, folks, we're here. We're your general contractor here, locally owned, veteran-owned, here in Cleveland, Tennessee. And we would love to help you out. If you're listening to this, whether you've got it tuned in on the radio this morning as you're dodging raindrops and doing your honeydew list on this Saturday morning, or maybe you've got us on the Mix 1041 app or you're streaming online, thank you for listening. And for all those watching on Facebook, how's everybody doing? Hope you're doing well. But if you're hearing this, chances are we can help you with any of your home improvement needs. Everything from building you a new house to just doing some bathroom, kitchen remodels. Maybe you need some new floors. Maybe you need an addition put on to get some extra room. Whatever the case may be, we're here to help. Don't forget, we also have our residential cleaning team that is ready to come out and help you out with anything in your home, residential cleaning, and also light commercial. We would love to help. Reach us at 458-4135, Pro 93 Home Solutions. So there's my shameless plug right off the bat, because I don't want to interrupt what we're going to talk about today. And Brian and I were just talking a little bit. I'm very, very happy to have Brian Fretwell here from Direct Primary Care. These guys have meant a lot to me personally and professionally. And with everything going on in the world today, I couldn't think of somebody better I wanted on this week to talk about. Brian, how you doing today, buddy?
I'm doing great. Thank you.
Thank you for being a part of this and agreeing to come in today. So first of all, tell us a little bit about who you are and about Direct Primary Care.
I'm Brian Fretwell, physician assistant, Direct Primary Care Associates. Been in Cleveland all of my adult life. Was a paramedic here in a previous life. Went off to school and came back. This is home for me.
Yeah, and you've also some military experience?
Yes,
right?
Absolutely. It's funny, I don't necessarily mention that too often, but that's how I got my start. I was a combat medic in the Army.
Well, first of all, thank you for your service, brother. Never forget. And second of all, Direct Primary Care. And I'm going to give my personal testimony to it here in a little bit, but tell me what it is about your guys' business model and your care model that makes you unique.
Well, Dennis, I think everybody knows that healthcare is really fractionated right now.
Yeah.
We're in an intervention mindset. Okay, and so primary care has really been lost over the years, and so we've had that emergence of urgent care, emergency room. If I need something, I got to wait till I get sick to get something done.
And then sometimes we're just treating symptoms and not the actual problem.
You got it.
Yeah.
We turn that around and try to have a comprehensive health and disease prevention model where we're looking at the person in a holistic way. So that's really what Direct Primary Care is about, is getting back that patient-provider relationship without a middleman, and that middleman is typically insurance.
Yeah, and when you're thinking, okay, well, what's this going to cost? Well, I think you'd be surprised. Tell them a little bit about what your guys' cost model is right now.
So, cost and cost transparency, I think you have to kind of talk about both of them.
Absolutely.
Because a lot of times you don't even really know how much you're paying for your visit with your insurance cost, with your deductible, with your copay, all of that good stuff. So we make it simple. Our cost is $60 a month. We include most routine medications, and we also include most routine labs at no additional cost, no copays, no deductibles. We don't pre-screen anybody and keep anybody out for pre-existing conditions. We see everybody from 2 years on up.
Yeah, and there is a cap, I believe. Is it $180 for a family?
Yes,
Yeah.
$60 per person, then $180 for a family. So that's 2 adults, 2 children, and if you have that big Catholic family out there, the rest of them are free.
Yeah, and here's the other part of that is you also have with that is there's no contracts.
No.
It's a month-to-month service.
No.
And what do they get for that? Other than you talked about prescriptions and labs, but talk about how just the practice of going to the doctor is different for you guys.
Sure. So what we've done is made this simple. We've put a doctor in your family now. So that's the easy way to say you have access to your primary care provider. We want you to develop a relationship with your provider. You're going to see the same person. You're going to see that person that you develop a relationship. And when I say see, that's in person. So you can see us in person. You can by telemedicine, by phone, email, text. We have an app that's specifically made for us and our patients that you can access us 24/7.
And folks, so let me get into this from a personal. You could say, okay, well, this is Brian. He works for him. He's got to say this stuff. So let me tell you a little bit about my story and why direct primary care has meant so much as an addition to my family. And number one, I've been treated like family, and I want to make that very clear from everybody, from Tim that is working all over the place to share the good news of direct primary care everywhere he can. But so much so that we've offered it for our independent contractors that work for us. Our families are a part of it now. And I'm going to tell you, he has to worry about HIPAA stuff. I can tell you whatever I want about me. First of all, I've got insurance. But what I can't stand and what kept me a lot of times from going to the doctor was the time commitment I had to make and the time lost. I'm a business owner. If it's during the business hours and I'm not doing something productive, my business is losing money. And going to a doctor, you may have a 9 a.m. appointment. So you get there a little early, you fill out your paperwork, you pay your copay up front, and the next thing you know, you're waiting for an hour to an hour and a half. And then you get back and you feel like you're making progress, and another half hour, and a nurse comes in and does your vitals, and then another half hour, and you may see your doctor for 10 minutes. And that is, listen, I loved my GP that I had. It is not anything against them personally. It's the model that insurance has dictated them, and you hear it all the time about, fast food medicine. That's what it feels like. You end up spending 3 hours at a doctor where you actually see the person giving you care for maybe 10 minutes of that. And that's frustrating to me. And when I found out there was a better way, it's been worth every penny. I have never waited, and let me say that again. I have never waited for my appointment. If I've had a 10:45 appointment, if I'm there at 10:45, I'm walking back to meet. Stacy is one of the folks here in Cleveland. That's who I see. If you've got an hour scheduled, folks, you're going to be in and out of there in an hour. But you get to spend that hour with your care provider. When they say direct primary care, it can't be any more direct than it is. And it's not just Stacy's when she talks to me, it's not just about what's going on then. She steps back and says, well, let's talk about what's around that. She gets a holistic. Folks, and look, I'm a big guy. Fat people don't like going to the doctor because you always get told the same thing every time. I told her this after my first physical there. It was the first time in 20 years that I had walked out of a doctor and not felt shame and not felt like depressed because I got to lose weight and I'm going to die. But you know what she did? She didn't hide any of that, but she gave me practical steps, and here's what you need to do, and here's what we can do, and I'm here in this with you. And the next day, I get through the app you were talking about, I get a message of her just checking on me. Mm-hmm. How's everything going? Right. What'd you think about what we talked about yesterday? Mm-hmm. Folks, it has given me a game plan to help change my health for the better and to feel like I've got somebody on my side. And if that's what you're out, and that's one of the reasons I wanted to have Brian on this week, is that right now in the environment we're in now we've got a new variant, and we're not here to talk politics. We're not here to talk about where we stand on stuff, politically. I want to tell you that I know for a fact, as a business owner, as a husband, and as a father, man, I'm confused. You don't know who to talk to. You don't know. We had someone in our office have a positive COVID test, got it from their son who had just got back into high school. Let me tell you that if you go to the CDC website and try to get some answers of what you're supposed to do and how are we supposed to, you'll be more confused than when you went there. And again, I know these places have our best interest, but and I know we talked a little bit off air. Epidemiology is hard.
It's real hard. And
it's when somebody that's a reputable researcher or a doctor, we get it framed as they're changing their mind, or maybe they just got science. See, that's the one thing about scientists is that for the most part, they're not beholden. They're beholden to whatever they can see now. Mm-hmm. But if that information changes, am I right? Then they're going to. They're not flip flopping. They're following what the research says.
Right.
And having somebody in our corner, what happened when this happened last week? I sat there. I was confused. Now, look, folks, I'm not a dumb guy. I can read some big words, even 2 or 3 syllables sometimes, without even pictures. But I was so confused because you got that responsibility of it's not just my business, but it's my home. I'm taking this home with me.
Right.
What can I do? And I made a phone call to Direct Primary Care. They got immediately back with me, kind of told her what was going on, and she said, okay, listen, I know it's confusing. It's confusing for us, and we do this every day. Mm-hmm. But here's what we would suggest. And I had a game plan. And having that kind of opportunity, and if you're listening out there right now, my question to you is, if that happened to you, could you have that kind of conversation within an hour with your doctor right now? And if the answer is no, I'm going to tell you, please, you need to look at Direct Primary Care. And I'm going to put you on the spot. What's a good phone number for them to reach out to you guys?
423-650-4831. That's our Cleveland office. We have offices in Athens and a new one opening up September 1st that we'll let everybody know of at a later date.
Okay. Any idea where that might be?
A little south of us.
Oh, a little south of us. Okay. So if you're listening, if you're hearing this, whether it's streaming or through the app or on traditional radio, 104.1 or 101.3 The Buzz, folks, listen, you can take advantage of a Direct Primary Care website.
www.directpca.com. And if I can jump in here for just a minute, there were a couple of things that you said that I really enjoy. I love it when I get to hear, and you said you're a patient first, so yeah. I'll just parrot what you said.
Yeah. Hearing
it from a patient, first the family aspect. Everybody has a corporate culture. We bring our corporate culture up front. One of the things that we say every day, is we treat patients like family. And so without any prompt,
yeah,
you brought that up. So I love it. That makes my heart warm. Second, insurance. A lot of people think when they start thinking about Direct Primary Care, we get lumped into an insurance type category because they're like, well, I'm already paying for insurance. Well, we're not insurance, we're care. Insurance is a product. Insurance is something that you pay for that allows you to pay more when you show up.
That's a great way to put it. I've never heard it put that way.
We are care.
Yeah.
You know, we are where the rubber meets the road. Okay.
Yeah.
So we believe we fit perfectly whether you have insurance or don't have insurance. Now, we really do like our patients to have insurance.
Yeah.
Because catastrophic things do happen.
Yep.
Surgeries happen. Bad things happen to good people every day. Okay.
Yeah.
But 80 to 85% of your healthcare needs are met in a primary care setting.
Yes.
They just are. Okay. And so we whittle that down to $60 a month. But if you look at, you hash that out, that's $720 a year, or for a family, around $2,100 a year.
Yeah.
What's your deductible? Ask yourself right now, what is your deductible?
Yeah.
And your deductible
it's more than that.
doesn't include your medications
No.
either. You know,
But I'm still paying for my prescriptions.
Sure.
Still paying for tests.
Yes.
I mean, you don't get a bill from the doctor. You get one from some lab service.
Yeah.
Right. You got to pay when you hit the drive-through at CVS. And the other thing, one of the things you just said that struck me was also that the component of care and the idea that 85% is, and I look back on, and I'm a stubborn, stereotypical guy sometimes. I go to the doctor when something's, falling off, like
right.
I might lose a finger. Then maybe I'll go get it checked out. But that's where it was. It hasn't been in ERs. It hasn't
Sure.
been, and what happens is, you said earlier about the urgent care model,
mm-hmm.
and that's really what I found is when half the time I know I'm sick and I need I got a sinus infection.
Mm-hmm.
I need to get in somewhere to get some antibiotics.
Mm-hmm.
Most of the time, I couldn't even get into my GP.
Mm-hmm.
By the time I was in there, I was either going to be dead from it or I was going to be over it.
Mm-hmm.
So I ended up at an urgent care at 6:00 at night,
mm-hmm.
getting that prescription I need and paying that extra copay.
Sure.
So it really is a different model. And folks, I can tell you it is, it's something you need to check out. So one more time, how do they get a hold of you?
They can give us a call at 423-650-4831 or go to our website, and you can actually sign up right from our website.
Yep.
We're directpca.com.
Okay.
It kind of our mindset is we're old-fashioned medicine, but in the modern way.
Yeah.
If that makes sense.
Absolutely.
Okay. Because we're technology driven.
Yeah.
So we were telemedicine before it was cool. okay, before COVID made it cool,
Yeah.
okay? Because we don't take insurances and we don't file any insurance claims, we don't have to play by their rules. So in the insurance and the fee-for-service model, what most people are used to right now, you're
not worried about that code you got to type in to make sure it gets claimed or they kick it back.
That's correct. Or you don't have to worry about a butt being in the seat to get paid.
Come on.
That's just really how it is.
Well, listen, when we come back, we've talked around it a lot, but when we come back, we're going to I want you to hear Brian a little bit, and I don't know what he's going to say, to be honest with you, but I trust them and I trust him. And some of the questions that I've been asking, and I know you guys have been asking yourself too. Kids are going back to school where, you see the news, you just get depressed. But we're going to talk a little bit about the elephant in the room, folks. Talk a little bit about COVID and the variant, vaccines, and kind of where we are right now. Hang in there. Stay with us. You're listening to a special edition, folks, of Home Solutions right here on Mix 104.1 and 103 Bucks. Are you tired of going to YouTube or Google for answers to your home improvement questions? Maybe you have more projects than you have time. No matter where you are in the process, Pro 93 Home Solutions is ready to serve you. Pro 93 is a local, veteran-owned company offering residential and commercial remodeling, cleaning, and security. Contact us today at 458-4135 or online at pro93homesolutions.com. Let the pros at Pro 93 find the solution for your home or business. That's 458-4135. Welcome back, everybody. Dennis Purvis here at Home Solutions, brought to you by Pro 93 Home Solutions. Folks, we're having a kind of a special episode today, talking a little bit about the most important thing in your home, you and your family, and how you're going to care for it and get health care. I've got Brian Fretwell from Direct Primary Care Associates here. And, folks, the name tells you what it is. It is Direct Primary Care, and the emphasis is I think equal on all three of those words. And if you listen to a little bit of before the break, you heard a little bit about my story and my kind of experience with them. But Brian, it's one of the reasons I wanted you in here is because of what kind of I went through personally, and our company went through this past week with a COVID scare and somebody testing positive, and what do you do? Mm-hmm. And I alluded to it earlier, but it's even when you go to the supposed nonpartisan, neutral places, even the information on those pages sometimes counter what it said, or just if you scrolled up. Mm-hmm. And it leaves you kind of confused where to go, what to have. And I said before, having somebody I could call, and within an hour I was talking to someone, to Stacy at Direct Primary Care, who was kind of saying, here's what we suggest. Here's what you need to do. Here's who needs to get tested. Are they vaxxed? Okay. Are they not vaxxed? Well, there's a different protocol for that. Mm-hmm. So first, let's just talk about, I'm just going to ask some questions. You answer them. If you don't want to, you don't have to. Is it as bad as we're seeing? Is it as bad as far as this variant and the spread? And it seems to be another little surge here of the spread. Is this politics? Is this the media scaring us to death, or is this a concern?
It's a concern. We're seeing more COVID patients now in this wave than we even did in the first wave.
Wow.
Now, with the caveat, we're not seeing as sick of patients as we were seeing before, but we are seeing a larger number. And that does go along with the data that says that this variant is more infectious but less morbid.
Gotcha. I've also seen something that it seems I've seen in a couple places now, that this is also a little more, while it may not be as serious for adults, especially if you've been vaxxed, but there seems to have some issues with kids, that it's starting to really, I guess it's just the ease of transmission. So, all right, so you're a medical professional. I respect you. I don't care how you come down. Where do you come down on the vaccine?
Very pro-vaccine. Okay. And I know that in our area, it's not a popular opinion.
Yeah.
Okay. But I trust the science. I trust the people who did the science. And I 100% trust our local medical community. Specifically, Dr. Khatri, I gotta mention her. She's our local infectious disease doctor. She saved my life, number one, when I was in the hospital.
Really?
No joke. But on top of that, you got to find her on Facebook. She's probably going to kill me, but you got to find her on Facebook. Listen, guys, she puts it out there. She gives real time, real life, what's going on in her world, what she's seeing, and her recommendations. And if you have any questions, instant message me.
Wow.
And when you have that type of buy-in within our community, and that's another thing we at Direct Primary Care do. We are community based.
Yeah.
And we want our community to be the best it can be. And health, it starts at health. You can't be the best that you can be without health, okay? But getting back to your question, where this is affecting us is the information that people are getting and how they're getting it, okay? Yeah. How information is received and what we understand, you bring some baggage with you to that.
Absolutely.
You bring some conscious bias. You find the things that you want to see. You find and believe in the things that you want to believe in, and it allows you to discount the things that you don't believe in. The one thing that the CDC does, I think, poorly, okay, is they're a bunch of epidemiologists and biostatisticians and public health PhDs, and they're not translating that into anything that's understandable for the layperson.
And I want to amen that because I read it. I was on that website. And again, I don't consider myself a dumb guy. Yeah, you may think I'm just a dumb contractor, but folks, it's disconcerting how confusing some of it was.
It is because it's being reported as scientific inquiry.
And as possible. As scientifically as possible.
Yes, it's scientific inquiry, and people just want to be told what to do. Tell me what to do.
Yes.
Do I do this or do I don't do this?
That's what we say to doctors. That's what when I come to you. That's when I go to Stacy. That's what I say. Look, what do I need to do to make this not happen anymore?
Sure. and what you're hearing from us, and what you're hearing from your listeners, is from their PCPs, is they're hearing, do this and you'll get better. But the truth is, there's science behind everything that we do because really we're scientists first.
Yes.
Almost everyone's undergrad degree is either in biology or chemistry.
Absolutely.
Okay? So we're scientists first. With that, you don't hear, well, this works for about 80% of the people. There's a 15% likelihood that this isn't going to happen. There's a 10% likelihood that you're going to have a cough, upset stomach, nausea, vomiting, diarrhea. Because that is the science behind things that are done with you, to you, and for you.
Yeah.
But you lose folks. Instead, they hear, I take this medicine, my blood pressure goes down.
Yep.
But the truth is, there's science behind what's being done, but you don't hear that part. And what's happening over with lay people, or even worse, reporters. I'm sorry, I love you reporters. But what's worse is reporters are trying to delineate and decipher epidemiological and biostatistical information and trying to report on that. And I'll tell you, I was a paramedic in a previous life right here in our town.
Yeah.
Okay? I've worked a lot of calls that ended up on the nightly news or in the press, okay? I can tell you there's a lot of inaccuracies.
Oh,
okay?
yeah.
But as humans, whenever you have and I'm not blaming them. What I'm telling people is that there are inaccuracies, and be careful where you get your information from. And I trust my medical community and the people who lead me in the way that we practice medicine and direct primary care.
And that's something that I wanted to be able to really get across today is, folks, if you're looking just to have, for me, that $60 a month, do I have to pay it? No, I've got insurance, right? But one of the things that I didn't realize it at the time when I signed up, but I realized it last week, that is worth every penny of the peace of mind of knowing that I've got someone to go to, because sometimes I just tell me what I need to do. Mm-hmm. That was my question.
Sure.
Look, I want to protect. I wanted to protect. I got not just my home and my family, but everybody that comes in and out of our office, all of our contractors that come in and out of our office, our office manager, my partners, all of us, we've all got wives, kids, husbands, partners, whatever the case is, that we don't want to take this home to. And being able to have somewhere, and I will tell you, direct primary care is a place like that. If you've been looking for that, if it's something, we kind of get nostalgic for the good old days, because I still remember my doctor growing up that saw me till I was 15 years old, Dr. Tay. He saw my dad he saw my dad literally until Dr. Tay died. Okay. It was that old school, because insurance companies, they were around, but they didn't rule the medical universe like they do now. Sure. They didn't dictate what the doctor has to do in order to just get paid. And we get nostalgic for that. So if you're looking for something like that, it still exists, folks, and it doesn't cost you through the nose to do it. It's $60 a month, and it's right here in Cleveland, in Athens, and apparently in some secret location to the south of us that's coming September 1st. So we have to get you back on in here
Sure,
to talk
absolutely.
about that. So let's not talk about the freedom aspect and the choice aspect of the vaccine. In your opinion, does this get better if we don't see more people get vaccinated?
No, it'll get worse. We'll get community immunity somehow.
Either by everybody getting it
Yes, but that everybody getting it
is going to be painful.
it's going to be real painful, and I'll tell you, people are going to die, and people who and I'm not. I believe scare tactics are used too much. Okay,
Yeah.
but I can tell you, I had a close personal friend, a person that I love absolutely dearly, and I'll get choked up a little bit. She died. She died because of it. And if there's something preventable that we can do, we should be doing it. Now, I will tell you, I am freedom of choice.
Yeah.
I think it's completely up to each individual's personal liberty where they stand on it. And I'll tell you that, and I know there are really hardline vaxxers, period, and there are really hardline anti-vaxxers. We take care of everybody at direct primary care,
No matter
period.
what. It doesn't matter.
You know what? That's a limitation. That's a barrier, and that is an access issue to care, and it's unconscionable.
Yeah.
You got to take care of people where they're at, and if we start putting our beliefs in front of patient care, no longer can you really care for the person. We got to take our personal feelings out of it and take care of people where they are.
All right. We got just a few minutes here before we got to get out of here. So we've kind of talked about this. Real quick, if somebody thinks that they've been exposed or finds out they've been exposed, I know there's also a lot of confusion on what kind of tests. For my understanding, there's two kind of rapid tests out there, like antibodies, antigen.
Well,
what do you suggest?
Antibody is really a thing of the past. I mean, it was the best thing that we had at the time. So it's not that it was bad. It's just not the best. We have much better tests now. Antigen really should be the only test that's done now.
Okay.
Okay. And then moving forward, and even with the rapid antigen test, I still believe, and the CDC has an algorithm as well. I'll decipher it for everyone. That you should get a confirmatory PCR test, which is
that's when you wait 2 days for.
You betcha. You betcha. And that's really what should happen.
Yeah, and listen, folks, I know you guys do provide the tests there. There may be an additional cost depending on the kind of test they get, but I do know this: that state of Tennessee does have it available at most CVS, Walgreens.
Yes.
Like, you can get out there and get a test for free,
Absolutely
whether you
free.
got insurance or not.
Absolutely free.
And so and that's another thing, man. Just because you don't have insurance doesn't mean you don't need care. If anything, you probably need it more than anybody that's got insurance. Give them a call. One more time, how do they get a hold of you guys?
Our phone number, 423-650-4831, or check us out online, directpca.com.
And listen, for the Facebook folks, also our community is something that I'm really proud of for you, and I'm really proud to find you guys.
That's our mission, man. Our mission is absolutely to give back to the community everything we can to the best of our ability.
Man, thank you for being here today.
Yeah, man.
Yeah, give them a call, folks. Check it out. Listen, I know it's kind of crazy out there. We're dodging raindrops this week. I know it's crazy because the news looks bleak. But look at the bright side. Some of you, your kids have finally went to school. Hallelujah. I know that's kind of the feeling in my house from at least one or both of the parents. Second of all, take care of one another. Love one another. Let's get through this thing together. We'll see you guys next week. You've been listening to Home Solutions right here on Mix 104.1 and 101.3.